This was a project that was very dear to my heart. I was born in this hospital. My grandfather was the chief plumber at the old Winnipeg General Hospital for 40 years, and my mother was a nurse in this same hospital where I was born. I'm Wilson Orr. I'm a principal with Park and Architects Limited in Toronto, and I had the pleasure and privilege of being the principal in charge for the development of the new women's hospital in Winnipeg, Manitoba. When you enter the hospital, you really feel as though there's a connection to what's going on with the rest of the world. There's all this beautiful light that comes in because the entire north side of the first floor and the east side of the first floor is all wrapped in glass. It's the waiting areas, the cafe area. So you feel connected to life. You don't feel as though you're enclosed within a hospital and nobody knows what's happening to you. You're not divorced from the rest of the world. You still feel that connection to the fact that life goes on outside the hospital. The hospital administration at the time really wanted a facility that would bring women's healthcare in Manitoba into a new kind of care paradigm. They definitely wanted to be patient and family centered. That was really key for them as well, that not only were they going to be functionally effective, but they felt by being that, they could be more focused on patient and family-centered care. And the windows in the patient rooms, and all the patient rooms are single rooms, which is just so wonderful because for so many years, hospital authorities didn't seem to recognize that in a women's hospital, in a postpartum unit, there's two patients in that room. There's a mother and there's the baby. And they don't need exactly the same type of care, but what they need is that opportunity to become a pair bond. The hospital does not have a lot of land around it. It's a very tight site, but we were still able to create areas of landscaping. So we very deliberately made the entrance to the hospital a 2-story space so that it's not low and enclosing. It's open, it's welcoming, and we wanted that to carry through the rest of the building. There's a beautiful landscaped area up on the 4th floor, and it's fun because the edges of the planters are all done in hot pink, which adds just that little shot of bright color to liven the space up. It's all natural Manitoba wildflowers and plants that are within the planters. There's seating areas, but what I really like about it is the fact that it opens up directly to the spiritual support spaces. It was also important to them that the building be sustainable, that it be designed to at a minimum of LEED Silver standards, and we worked with a specific consultant on that all the way through the process. Healthcare is not isolated, it is part of life. And I think that's the thing that I like the best about the hospital, is that it still has that connection to everything else that's going on around it, while it has the privacy and the cocooning that's necessary for some of the activities that happen within the hospital. And what I really love about what we do is going back into a hospital and seeing the way the staff, the caregivers, and the patients have made it their own.